Hey guys, welcome back to my channel, and if you're new here, my name is Christina. In today's video, I'm going to be giving you 5 different tips on how to do well in pediatrics. In my videos, I talk all about nursing school and a plant-based diet. If you like these types of videos, please like this video and subscribe down below. Let's get into it. I had to take pediatrics in my second semester of nursing school, and I really thought that it was going to be super easy because I have a 2-year-old daughter. Now, it did make it easy in the sense that I knew kind of what stages would be happening during which certain times, but also when you compare those different stages to a child, every child is different. So what the textbook might say isn't necessarily what's going to happen in real life. Because like I said, every child is different in how they develop and grow. My daughter was advanced in certain areas while behind in others. So it really depends on the child. So it's really important to keep that in mind, that if you have nieces, nephews, or if you're a mom like myself, then make sure that you do not answer your questions on your exams based off real life situations. And that goes for any class because they are so different from the textbook answer to in person. So if you don't know that, now you do. The second tip, which I feel like is one of the most important things, is to really know the developmental stages based off of the different stages that you have to go over. So if you have your certain tests where you have to know about a toddler or a newborn, make sure you know those growth and development stages like the back of your hand. So for our class, we needed to know Erickson and Piaget. So we had to know what would happen during that stage, an example of what a response might be, so that you could answer those critical thinking questions. On top of it, as they are growing, different things are happening. So at what age can an infant hold their head up? 8 months, by the way. But what ages can they walk, or what ages can they sit by themselves or with assistance? It's very, very specific little things like that that you have to be careful not to mix with one with another, because it's really easy to get tripped up on the different ages of the children based off of the different categories that they're falling under. So for example, if they're falling under one category of being in preschool ages 4 to 6, then you might think, okay, every child that's between ages 4 and 6 can do X, Y, Z, but that's not the case. A lot of times the questions will be like, at age 4, what can they do? At age 5, what can they do? At age 6, what can they do? So make sure that you aren't focusing just the categories by themselves, but focus on the individual ages as well. So if there's something specific in your textbook that goes over it or in your teacher's notes, make sure to be aware of that. At my school, my teacher was very specific with the questions as far as knowing particular ages for the different stages of development. The third thing that I wanted to go over with you guys, which is super, super important, is to make sure you know the different immunizations for children and at what ages they are going to be receiving certain things. So knowing that at birth, what do they get? By age 1, how many immunizations should they have had? And going forward, when should they be having their next immunizations is super important, because after the age of 1, they have certain vaccinations or certain immunizations that they can only have at that age. So if it is a series of vaccines, how many of each vaccine do they need, and at what ages would the child need it? It is super, super important to know these like the back of your hand as well, because you are going to be tested on it. And even going forward, when you become a parent, this is so important to know, because as you're going through this class, you're going to be consistently tested on it. At least, again, that was in my class, and it seems to be a big concept in pediatrics, rightfully so. Because it is important, even if you're working in the pediatric setting, you might have to speak with parents who didn't get their children vaccinated or didn't have them have certain immunizations, or let's say they got the first one at birth and then they didn't follow up in like a year or a few years, however many months it took in between. It is super important to understand when these vaccines are needed, especially in this class, because if you're at your clinical setting and you're speaking to parents and you realize that their child has had an immunization at birth but then you realize in their record they never got the second dose. Then you need to make sure that the parent is aware of this, and if they have something already scheduled, or if they're planning on doing it, or maybe they didn't know, maybe they weren't told that they have to come back. Sometimes that does happen. That actually happened with my daughter, where we weren't made aware that she needed another vaccine to come back, because they get so many vaccines as a child that sometimes they forget how many times they've been poked, or you know, they have a record of it, but sometimes they forget to tell you, hey, come back in a month for that third vaccine or a fourth vaccine, because some offices, they don't like to prick a child like 5 times at once, because first off, it's really traumatic to a child to undergo that, and then you have to deal with the parents upset because, you know, their child's getting all these vaccines at once, and then the child's irritable and they don't feel well. So it's really, really important to educate the parents, and it's really important for you to know when the child is supposed to get these immunizations done. Another tip that I have for you guys is to make sure that you understand what happens to a child when they get sick. What sort of characteristics and what sort of things will you notice right away? What happens to their respiratory rate? What happens to their blood pressure, their pulse, their temperature? What sort of things do you have to look at to see what is going on with them? And what sort of things do you look at on a child to compare them between a certain disease maybe, or a certain virus, or a certain bacterial infection, to understand the process is a little bit easier. When you think of it that way, you can make your own story. And then on your test, when you have different scenarios, you're able to think back to your story that you had made about different children having different sort of symptoms. And if you could picture that, you're able to answer questions a lot easier. So I would definitely try to incorporate some sort of story or mnemonic to help you remember certain things. I like to come up with those different things so that it's easier for me to remember them on an exam. The last thing that I recommend doing is to definitely look at other YouTube videos online about the material and how to learn certain topics that you're having trouble with. So I do this with every single class. Anything that I have any questions about, I automatically go to YouTube and find a video related to that. So those are awesome resources that are free, and it doesn't require a lot of effort. And then sometimes they even have their own mnemonics or their own stories that are even more helpful because they came up with their own material to make the video. So that's always helpful, and that is how I did well in pediatrics. I hope this video helped you guys, and if it did, please like this video and subscribe down below. So if you guys have any questions at all, please feel free to let me know. I do not mind answering your questions. Just leave a comment down below, or you could always DM me on Instagram. Either way works for me. I'll get back to you as soon as I can. I can't wait to see you guys next time. Bye!